Okay, this video is for abdominal bracing and contraction of the pelvic floor and glutes in a reclined squat position. So I'm going to have you lay on your back with your feet on the wall with the hips and knees at about 90 degrees. Put your hands around your lower rib cage and you're going to take a nice deep breath in and then out. And you should feel your rib cage drop towards your pelvis and that lower part of your abdomen pull in like underneath your belly button. And you want to keep your rib cage connected to your pelvis as you then take another deep breath in, feeling the expansion around your fingers or underneath your fingers while keeping that lower contraction. Take a couple breaths here to practice that breath and contraction. It's not a strong contraction, so don't feel like you have to necessarily pull your belly button all the way to your spine, but just a general tightening. After a couple breaths of practicing this, hold that brace and contraction as you push your feet into the wall and lift your hips straight up. Now you're going to continue to practice that breath here. Really trying to keep the lower abdomen, pelvic floor, and glutes engaged while that rib cage is expanding underneath your hands to give a good diaphragmatic breath. This is the feeling you want to feel when you're going through a squat or a bent over position and have to do some lifting. For more of a challenge, lift your arms up above your chest towards the air as you stay lifted and try to really control that contraction with your breath. Then bring your arms down and try some marching in this position. You shouldn't have your hips drop too much as you switch between sides. Go ahead and give yourself a little break. And now I'm going to scoot closer to the wall. So I'm going to be in more of what my true bottom of my squat position will be. And then I'm going to practice that same breath here. So you can go as close to the wall as you feel comfortable of kind of where you would be in the bottom of a squat. Breathe in, breathe out, breathe in and hold and lift. And then just practice the breath here. There shouldn't be any pain or discomfort. Should just feel a nice muscle contraction through the pelvic floor, the lower abdomen, and still feeling like you can breathe through your diaphragm. Once you have that, arms up, and then you're going to reach those arms overhead without flaring your rib cage. If you have a mirror to watch yourself, it's a really great idea. And try to get your arms all the way to the floor overhead without losing that connection in the rib cage. Helps if you move with your breath as well. After a few of those, go ahead and relax there.